It's been an ongoing debate for the past few years, health care in our country. The conversation's been overshadowed by other issues lately, like gun control, but some fuel is about to be added to the fire right here in West Alabama. Dr. Richard Streifer, Dean of UA's College of Community Health Sciences, is here to tell me more about it. Dr. Streifer, thank you so much for being with us
My
today.
pleasure.
And I did say your last name correctly.
You got it.
All right, excellent, good deal. This is a movie,
It is.
and you described it to me during the break as being an objective movie. Tell us about it first, and then we'll get your take on it.
Well, it's a documentary that attempts to explain the issues in our healthcare system for folks who don't spend their working day like I do living in the healthcare system or in health professionals. The issues are so complicated that so many folks just feel out of control in understanding it. They understand I can't see my doctor when I want. He or she only has 2 minutes with me. It's expensive. You know, this sort of thing, but they don't understand the root issues. And that's what this movie, in part, is attempting to do. It's done by some award-winning documentary filmmakers and is being distributed actually to medical schools to allow them to do screenings as we're doing and begin to start a community conversation about the problems with our broken healthcare system and what we as a community can do to begin to change that, what's within our control.
Now, you mentioned to me during the break that you've seen this movie not once, but many times.
I have.
And you consider it to be objective. Now, when a lot of people think healthcare movie, healthcare documentary, something that pops into their minds would be Roger Moore's
Michael
Moore, I'm sorry, not 007,
Right.
Michael Moore's Sicko, which
Correct.
many people would consider not to be an objective movie.
And I would agree
not
with
to be
that.
a very good documentary either, because it strays so far from traditional documentary filmmaking. But in your opinion, this is objective. Why do you see it that way?
Well, come see it. It basically interviews and utilizes people experiencing issues and is very evidence-based and factually based. It does not have spin. It does not have a political agenda. It is about getting the issues in our healthcare system out there in an understandable way.
There we go. Now, one of the things that we encounter here in our line of work, and that I'm sure the folks at home run into as well, is the staggering amount of misinformation that just gets batted around all over the place out there.
Right.
And it seems this issue is so divisive. You're either in favor of health care reform or you're not in favor of health care reform. And if you are, you're, you know, some sort of pinko liberal commie, and if you're not, you know, then you're some sort of conservative militia member hiding in a bunker somewhere. And it seems like the extremes control the conversation, and they spin facts in such a fashion to where it services their side of the argument.
Exactly.
Can we actually go somewhere and get facts about what actually does happen in our healthcare system in this country that aren't
you can.
grossly skewed?
Yes, you can. And in fact, that's, again, the intent of this type of conversation. Let's not talk about healthcare reform. Let's talk about the characteristics that everyone agrees about on our healthcare system. It's the most expensive healthcare system in the world, unarguably, twice our closest competitor. And it's a poorly performing healthcare system, meaning that we're not getting value for the dollar that we spend. We rank in the lowest quartile of the industrialized world in terms of health outcomes. Now, admittedly, we have amongst the greatest technological resources for extremely ill or complicated or rare diseases. We have the best trained health professionals. But as a population, we are not getting value out of our healthcare system. And the costs are growing, and we're getting an increasingly sicker, unhealthy population. Those are factual things that no one debates anymore. And in fact, the healthcare reform debate helped to bring this up. The question is how to move forward. What can we do? What is within your control when you go to the doctor? What is in my control as a family physician to be able to offer a different type of quality and a different value as a provider? This is the beginning of a conversation. You've got to start talking about it to begin to come up with solutions. And this is not a political solution. It is what we can do as a community within our control.
Now, in our system, and I guess in every system, some of them have insurance companies, some do not. It seems to add another very large organization to the equation. We're treating individuals with specific individual ailments. We're diagnosing them one-on-one, but it's managed from almost a frighteningly gargantuan system. I feel that a lot of times simple people, including myself and the folks at home, get intimidated by this system. The letters from insurance companies, what's covered, what isn't covered. And then in some situations, as sad as it is, insurance companies trying to get out of paying things that should be covered. Now, is that something that happens in Escape Fire, which is the title of the movie, which I don't think we've gotten around to saying?
Yeah, it does address many of the inefficiencies and the administrative costs. It also importantly addresses the, if you will, perverse incentives that exist in medicine, not to assure a healthy population, but to do more. Americans believe that more is always better. Well, more food is not always better. We know that. We're talking about obesity a lot. More health care is not always better. The right health care is better. More often leads to unnecessary cost and even harm by finding things out that have no consequence but end up leading to other tests, other referrals, other doctors, even procedures. So it definitely gets at these types of incentives that you're talking about.
Well, unfortunately, we're out of time. But Dr. Streifer, wonderful conversation. Thank you so much for coming and being with us. I feel smarter already. All right, you can catch Escape Fire Sunday, March 3rd at the Bama Theater. The show starts at 3 p.m. and it's free to the public. You can find out more by calling 205-348-9103 or online at escapefire.com.